Why are chronic headache pain pathways so complex? Imagine trying to follow a maze that has many different paths, some overlapping, some branching off in unexpected directions. That's what the pain pathways in chronic headaches are like. They involve a web of nerve signals, blood vessels, and brain activity that all work together. The main player in headache pain, especially in migraines, is the trigeminovascular system. This includes sensory nerves from the trigeminal nerve that connect to the protective layers around the brain and the blood vessels inside the head. When something triggers these nerves, like inflammation or changes in blood flow, they send pain signals. These nerves have different types of fibers. Some fibers, called unmyelinated C fibers, and thinly myelinated A delta fibers, carry pain signals. Larger fibers, called A beta fibers, usually send non-painful sensations. The mix of these fibers adds layers of complexity because they respond differently to stimuli and send signals to different parts of the brain. Once the pain signals leave the trigeminal nerve, they travel to the brainstem, specifically the spinal trigeminal nucleus. From there, they move upward through a pathway called the trigeminothalamic tract to reach higher brain centers like the thalamus and the cortex. Along this route, certain receptors, such as glutamate receptors, can amplify the signals. This process, called central sensitization, makes neurons more responsive over time, which can lead to persistent pain. During a migraine, neuropeptides like calcitonin gene-related peptide are released. These cause blood vessels to widen and trigger inflammation, which further activates pain pathways. Because calcitonin gene-related peptide can act over larger areas, it spreads the pain response, making headaches more intense and widespread. That's why medications targeting this peptide have been effective in treating migraines. But the story doesn't end there. Brain imaging shows that many regions involved in pain processing change in people with chronic headaches. Areas like the anterior cingulate cortex, thalamus, and insula show altered activity. These changes suggest that the brain's pain control systems are not working properly. Normally, parts of the brain called the descending pain pathways help suppress pain signals, but in chronic headache sufferers, these pathways often don't function well. Adding to the complexity is cortical spreading depression, a wave of electrical activity that moves across the brain's surface. This wave can trigger migraine aura and activate trigeminal nerves, setting off a headache. It involves interactions between neurons, blood vessels, and nerve fibers, making the headache process even more complicated. All these factors, different nerve fibers, chemical messengers, brain activity changes, and faulty pain control, interact in ways that make chronic headache pain very complex. It's not just one thing causing the pain but a network of systems working together. That's why treating chronic headaches often requires approaches that target multiple parts of this system. In essence, the pathways involved in chronic headaches are like a busy, interconnected highway system. Multiple routes, signals, and stops all contribute to the ongoing pain. Understanding this helps explain why managing chronic headaches can be challenging but also why there are many promising treatment options that target different parts of this complex system.